You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Mark Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 4, Coffin joint arthritis.
Introduction.
Coffin joint arthritis, also known as distal interphalangeal (DIP) joint osteoarthritis, is a degenerative condition affecting the lowermost joint in the horse's limb, located between the second phalanx P2 and the third phalanx P3, commonly referred to as the short pastern and coffin bone respectively. This joint plays a crucial role in shock absorption, flexion and weight bearing, particularly in the front limbs, which bear the majority of a horse's body weight. When the coffin joint becomes arthritic, it can result in chronic lameness, reduced performance and long-term discomfort. Understanding the pathology of coffin joint arthritis and how diagnostics such as nerve blocks, radiographs and other imaging tools contribute to a targeted farriery plan is essential for improving outcomes in affected horses. Effective management extends beyond farriery and includes owner education, environmental changes and nutritional strategies.
Clinical signs.
Coffin joint arthritis is characterized by progressive degeneration of the joint cartilage, leading to inflammation, pain and eventually the formation of bone spurs, osteophytes, and narrowing of the joint space. The disease can develop gradually due to repetitive stress, poor hoof conformation or trauma, but in some cases it may be secondary to other conditions such as chronic imbalance or previous injury. The condition is more commonly seen in mature horses engaged in high impact disciplines such as jumping and eventing, but it can also occur in pleasure horses or those with naturally poor hoof conformation. Dyson and Murray 2007.
Diagnosis.
Diagnosing coffin joint arthritis involves a combination of clinical examination, diagnostic nerve blocks and imaging. The horse typically presents with mild to moderate lameness that may worsen with hard work or when turning on hard ground. Flexion tests may be inconclusive and heat or swelling in the foot is often absent. Diagnostic nerve blocks are essential for localizing the pain to the foot. A Palmer digital nerve block, which desensitizes the back 2/3 of the foot, may significantly improve lameness. To specifically target the coffin joint, a direct intra-articular block can be performed by injecting local anaesthetic into the joint itself. A positive response confirms the coffin joint as the source of pain. Turner, 1992. Once the joint has been identified as a source of pain, radiographs are the next step in confirming and evaluating the extent of arthritic changes. Standard projections such as the lateromedial and dorsopalmar views can reveal joint space narrowing, the presence of osteophytes and sclerosis, increased bone density around the joint margins. In some cases, oblique or skyline views are needed for better visualization of the joint surfaces. Radiographs also help rule out other conditions that may mimic arthritis, such as navicular syndrome or fractures. Butler et al. 2008. For horses with inconclusive radiographs, advanced imaging such as MRI or CT may be employed to detect early cartilage damage or subchondral bone lesions. Ultrasound, though limited in evaluating the coffin joint due to its bony enclosure within the hoof capsule, can sometimes aid in assessing surrounding soft tissue structures. Thermography and nuclear scintigraphy are occasionally used in complex lameness cases, but are less common due to cost and availability. Diagnostic arthroscopy, where a small camera is inserted into the joint under general anaesthesia, remains the gold standard for assessing joint surface health, but is typically reserved for cases where surgery is being considered.
Farriery treatment.
Once a diagnosis has been established, a tailored trimming and shoeing plan becomes central to the horse's management. The main goal of farriery is to reduce stress on the coffin joint, improve hoof balance and restore biomechanical alignment to slow the progression of arthritis and reduce pain. Horses with coffin joint arthritis often present with long toes and low heels, which place excessive strain on the coffin joint during breakover and increase the load on the deep digital flexor tendon. Radiographs provide essential information about bone alignment, sole depth, and the position of P3 relative to the hoof capsule, guiding the farrier in making precise adjustments. O'Grady and Poupard, 2003. Trimming should aim to establish a straight hoof pastern axis and shorten the toe to ease breakover. Heel support is crucial, and in many cases a mild heel wedge, incorporated as a frog support pad of a synthetic, leather or multi-material, may be introduced to reduce strain on the joint. For horses with medial lateral imbalance, asymmetrical trimming may be required to restore even loading. Shoe selection depends on the severity of the condition and the horse's workload. Rocker toe shoes, roll toes or egg bar shoes can be useful for easing breakover and reducing joint compression. In more advanced cases, heart bar shoes may be applied to support the frog and redistribute weight across the foot. The use of pads and hoof packing can further enhance comfort and support. Pour-in pads or silicone-based impression materials can cushion the sole, improve load distribution and reduce concussion on hard ground. These materials can be used under open shoes or combined with bar shoes depending on the horse's needs. In horses with thin soles or sensitivity across the entire foot, full sole support can be helpful in protecting the internal structures, including the coffin joint. Hoof packing materials infused with anti-inflammatory or antimicrobial agents may be selected to address concurrent issues such as bruising or infection. Composite shoes made of lightweight and flexible materials such as urethane or plastic polymer blends are increasingly being used in horses with joint pain due to their shock-absorbing properties. These shoes often include breakover enhancements and can be moulded directly to the hoof, reducing stress on the coffin joint while allowing for more natural hoof function. Composite shoes are particularly useful in cases where metal shoes may be too rigid or where traditional nailing is not possible due to poor hoof wall integrity. The adaptability of these shoes also makes them ideal for use in horses that require frequent changes to their hoof mechanics.
Veterinary treatment.
Veterinary treatments may be used alongside farriery to support the joint and reduce inflammation. Intra-articular injections with corticosteroids and hyaluronic acid are commonly administered to relieve pain and lubricate the joint. More recently, biologic therapies such as IRAP, interleukin-1 receptor, antagonist protein, and PRP, platelet-rich plasma, have been used to slow the degenerative process and promote tissue repair. Systemic anti-inflammatory medications such as phenylbutazone or thyrocoxib can help manage pain during flare-ups, but their long-term use should be carefully monitored due to potential side effects. Dyson, 2011.
Owner management.
Owner management plays a critical role in the rehabilitation and long-term care of horses with coffin joint arthritis. Daily turnout is beneficial as movement helps maintain joint flexibility and circulation. However, hard or uneven ground should be avoided and deep, boggy footing can also place excessive strain on the joints. Where possible, horses should be exercised regularly but moderately, with adjustments made depending on the horse's response. Activities that involve tight turns, hard stops, or jumping may need to be reduced or eliminated. Monitoring the horse's stride and behaviour can provide early signs of discomfort, allowing for timely adjustments to the management plan.
Diet and nutritional guidelines.
Diet and nutrition also play a significant role in supporting joint health. Horses with arthritis benefit from maintaining an ideal body condition score, as excess weight increases joint load. A forage-based diet with appropriate levels of protein, vitamins and minerals is fundamental. Supplementation with joint supportive nutrients such as glucosamine, chondroitin sulfate, MSM methyl sulfonylmethane, Omega-3 fatty acids and antioxidants like vitamin E has shown promise in reducing inflammation and supporting cartilage health, although the scientific evidence varies. Van Wieren et al. 2011. Horses with insulin resistance or other metabolic issues should be carefully managed, as systemic inflammation can exacerbate joint conditions.
Conclusion.
Regular reassessment by the veterinary and farriery team is vital. Radiographs should be repeated periodically to monitor disease progression and ensure the trimming and shoeing plan remains appropriate. Farriery intervals may need to be shortened to maintain optimal balance, especially in horses prone to rapid hoof growth or distortion. In some cases, horses may be transitioned to barefoot management if the hoof conformation and comfort allow, though this decision should be based on radiographic findings and veterinary guidance. In conclusion, coffin joint arthritis is a challenging but manageable condition when diagnosed early and treated with a multidisciplinary approach. Nerve blocks and radiographs play a central role in pinpointing the source of lameness and understanding the structural changes within the joint. These diagnostics provide the foundation for an informed trimming and shoeing plan that aims to reduce joint stress, improve comfort and slow disease progression. With appropriate farriery, veterinary care and dedicated owner management, including thoughtful exercise routines and supportive nutrition, many horses with coffin joint arthritis can maintain a good quality of life and continue to work at a comfortable level. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.